Okay, so another quiz video. Let's go to chapter 4, the quiz. Okay, so looking here, there is an obvious ptosis, but the pupils are equal in size. And switching off the lights, the pupils are still equal in size. That pupil reacts normally. That pupil reacts normally. And the swinging light test, both reacting normally. There's no RAPD. So with the ptosis, this eye also looks like it's deviated down and out. So those are changes that you can get with a third nerve palsy, but it looks like the pupils are normal. So in terms of the questions here, question 1, are the pupils normal or abnormal? Well, they're normal. Is there anisocoria in light or dark? No, the pupil sizes are the same. Does each pupil react to light? Yes. Is there an RAPD? No. What kind of defect is this? Well, the pupils are normal. What would you expect the vision to be in the affected eye? Well, you'd expect the vision to be normal. If this patient was a 62-year-old type 2 diabetic who developed diplopia 2 days ago and has an associated headache, should they be admitted to hospital? Okay, well that's a bit of a tricky question, but the answer I've put here is that they're probably not, because it's a pupil sparing third nerve palsy. The pupil's not affected, and in a 60-something-year-old diabetic that's likely to be microvascular. So it says here that they need to basically be very careful examination of the other cranial nerves to confirm an isolated palsy, and we've already shown that the pupils are not affected. You could also get some urgent bloods to check for giant cell arteritis, which can occasionally present as a third nerve palsy, and other people might recommend that you reassess the pupil in 24 or 48 hours just to check that the pupil is definitely not affected. So I've got a list of the red flags that you can get with third nerve palsy. If I go through to the just a way of thinking about whether or not you need to urgently admit someone with a third nerve palsy. So things that are urgent are pupil involvement, reduced consciousness, stiff neck, photophobia, age under 55, so not having a good reason for having a microvascular episode, unless they're a known long-standing diabetic, and obviously the bottom one there is that they've got other cranial nerves affected. And then the reassuring things would be older age, because that would imply that they've got a reason for a microvascular episode, diabetes and hypertension as causes, headache, but no neck stiffness, and the third nerve palsy being isolated or intermittent long-standing. Here is the picture of the what an aneurysm can look like. I'll just come back to that in a second. I'll just go back to the so here we've got the third nerves just in a normal setting. Third nerves are in green. Got them on each side obviously. And then if we go to that same setting, but this time we have the expanding aneurysm. So here's the aneurysm sitting just where the middle cerebral and anterior cerebral arteries divide, and this is where the posterior communicating artery is coming off, and this is the sort of weak point where aneurysms can develop. And then if I just and then this is just showing what sort of eye movement abnormalities you might detect with a third nerve palsy. So it's that same left side where it's abnormal, and as we're moving our light target across, you can see that this left eye doesn't go up. It will come up to the midline, but it won't go up above the midline, above the horizontal midline, and it also won't pass across the vertical midline as well. And in real life, that ptosis might be complete. You might only be able to see that by lifting the eyelid as you examine the eye movements. So, I hope that's given you a little bit of stuff to think about with the third nerve palsy. Hope that helps.